Hello and welcome everyone. I'm Caitlin, registered nurse and president of Climate Action Nurses in Australia. I welcome you with great pleasure to session 8 of Nursing on the Front Lines of the Climate Crisis, Education for Action. The topic today is heat-related illness. I'm genuinely so excited to hear from our speakers tonight on this topic, as the issue of heat is one that's very close to my heart. In Australia, recent meteorological analyses have shown that we have already surpassed an average warming of 1.5 degrees Celsius in some parts of Australia, which is just phenomenal. Before I begin, I just want to say thanks to our partners, and please refer to our website for more information. Here you'll find the course objectives, course schedules, slide decks for each recorded session, along with other very detailed information and our session resources. Just to reiterate from previous weeks, individual attendance is automatically recorded during the live Zoom sessions and video recordings for asynchronous views. The video recordings for each asynchronous attendance will be available following each session for asynchronous view on the Alliance of Nurses for Healthy Environments platform. We'll be offering continuing education for US-based participants. Continuing education, or CE, will be provided through the Alliance of Nurses for Healthy Environments. In order to receive CE, one CE will be available per individual webinar. Participants must attend the live webinar session or view the recording asynchronously and receive at least 80% on the post-session evaluation. Participants who attended the live webinars on Zoom will be provided a password which allows them to bypass the video viewing requirement, and it will come from the following website seen here on the slide. Please allow 2 to 3 days following each live session to receive this email, and don't forget to check your spam folder as well, as we know emails do sometimes appear there. Participants don't need to complete the CE process in order to receive a certificate of participation. Certificates of participation will be offered to participants who attend at least 7 out of 10 live Zoom sessions or review the recordings asynchronously and pass the course final exam with a score of 70% or higher again. Please save the date of the final exam, which is up on the screen. It'll open on Thursday, December 5 at 12 p.m. EST New York City time and close on December 10 at 11:59 p.m. EST. Please note, it is mandatory to use the same email address to join the Zoom classes, watch the video recordings, take the session post-tests, and of course, the end of course survey. Now, it is my absolute pleasure to introduce our speakers, and though we may all know and recognise Michelle, Gina and Karen very well by now, I would love to informally introduce them as our speakers for today, I should say. First, we have Dr. Michelle DePhillips, an assistant professor at the University of Delaware School of Nursing. Earned her Doctor of Nursing practice from the University of Virginia 2017 and her Master of Public Health from George Washington University 2024. As a nurse fellow with the Global Consortium on Climate and Health Education, Dr. DePhillips has educated community health workers on heat-related illness in India and co-developed pediatric heat illness educational resources. Dr. Karen Duderstadt, Doctor of Philosophy, PhD, registered nurse practitioner, is a clinical professor Emerita at UCSF School of Nursing. Her PhD research focused on healthcare access for low-income children, and she served at San Francisco's General Hospital's Children's Health Center. A founding member of the Alliance of Nurses for Healthy Environments, she has led environmental policy initiatives and collaboratives with the Global Consortium on Climate and Health Education to develop climate-focused nursing curricula. An author of pediatric textbooks, Karen has published on child health, policy, environmental health, and health inequities. Dr. Gina Friel, a pediatric nurse practitioner at Annapolis, Maryland, holds a Bachelor of Science in Nursing and Doctor of Nursing Practice from Villanova University. As the first nursing postdoctoral fellow at the Global Consortium on Climate and Health Education, Dr. Friel co-founded the Nursing Climate Resources for Health Education, N-CRHE. She currently directs the Global Nurses Working Group, advancing nursing education on climate and health through this groundbreaking collaborative work with a worldwide team of nursing professionals pursuing the continued development of open access N-CRHE materials. She and her team most recently developed this course, which we all benefit from, Nursing on the Front Lines of the Climate Crisis, which is the first ever complimentary global course for nurses on climate and health. It is an honour and my pleasure to introduce and welcome Dr. DePhillips, Dr. Duderstadt, and Dr. Friel.
Thank you so much, Caitlin. I'm just going to take a minute to share my screen. Okay. So here are our learning objectives for today. To briefly summarize, what we're going to talk about is how climate change is impacting global temperatures, who's particularly vulnerable to heat, how we can recognize heat-related illness, and then finally, what nurses can do that's preventative to help protect our patients and our communities. So we've heard from wonderful speakers throughout this webinar series, and you may have seen this image a couple times throughout the series, but I really want to highlight how climate change is really impacting a multitude of different health outcomes and how heat overall is really creating a lot of difference on health outcomes in our world. So we see heat impact the migration of vectors, we see it impact the growth of crops, we see it impact air quality, and today we're going to look at heat through the lens of extreme heat days and temperatures and how that can create heat-related illness that impacts both our health and our infrastructures. So this is an image from the IPCC 6th report, which came out in 2023. And it's showing how heat extremes will become more pronounced with each incremental increase in global temperature. So in other words, with our current path that we're on with emissions, what we're going to see is more and more days of extreme heat globally. Again, this is going to impact health outcomes. It's going to impact our communities and our infrastructure. And looking at this change over time, we can see that in the past 30 years, that the extreme temperatures and this warming has been happening exponentially. So we see these impacts throughout the globe. And just this past year, you can see from the map here, multiple areas throughout the globe have had 50-degree-centigrade days. So you can see here the US, Mexico, Pakistan, China, Morocco, Algeria, Saudi Arabia, Iran, India, and Kuwait all have experienced extreme heat days. And these locations are just the start. We're going to start to see more areas throughout the globe that are experiencing this extreme heat. So this image is a more broad general image to talk about our vulnerability to climate change. And I encourage you within your nursing role to kind of think about these different factors that impact vulnerability of our populations for all of the different pathways that we've talked about. So today I'm going to really focus in on heat. But when we think about vulnerability, it's important to consider three major categories of how that can impact our health outcomes. The first is your vulnerability factors. These are more of your individual susceptibility factors and are very specific to that kind of individual person. Then we have the different exposure pathways. So today we're going to talk about heat, but you would kind of look at the actual extent of exposure to that different climate exposure. And then finally, we have our health systems and capacity and resilience. So this is how we're adapting and what structures we have in place to adapt to these different climate events. So as I said today, when we talk about vulnerability in terms of heat, we're going to kind of frame it into three different major categories. So first is that individual susceptibility. So these are those medical and person level factors that we can look at and kind of highlight in our nursing role of who we should provide education to, who we may need to advocate for that may be extremely vulnerable to heat exposure. We have sociocultural factors. So these are those additional social factors that impact someone based on the group they belong to. And within this discussion, I'm also going to talk a little bit about some of the social determinants of health and that adaptive capacity. And then finally, we have the heat exposure itself. So these are the factors related specifically to that heat, the extent of heat, how long someone is exposed to the heat that make them particularly vulnerable. So physiologically, we know that when the body is exposed to heat, it compensates. And it does this by sweating, by dilating our blood vessels, by changing our respirations. And so knowing this background helps us to understand why certain groups may be more sensitive to the heat physiologically. So we're going to talk a little bit about these specific groups that tend to be sensitive to heat. So we'll highlight how pregnancy, young children, the elderly over age 65, persons with chronic medical conditions, and persons taking certain medications may be particularly vulnerable to heat. Again, this is important within our nursing role because we can really tailor our education and we can really advocate for some of these groups when we talk about heat preparedness and making sure that people are aware of their heat risk. So when we think about pregnancy, the body changes during pregnancy to accommodate for a growing fetus, and these energy demands actually generate heat and increase heat risk within the body. We also see that with increased sweating and dehydration, this can cause in the body for a pregnant woman, reduced amniotic fluid, reduced breast milk. It can also divert some of the blood flow away from the growing fetus. And we see this kind of combination of effects put higher risk for preterm and stillbirths. Among young children, we can see that children have a higher heat production, especially upon exertion. They have a greater surface area, so more heat can be absorbed. And there's less temperature regulating capacity due to those developing body systems. So the circulatory system is still developing. Proportionally, we see less cardiac output. The immune system is still developing. The sweat glands are still developing, so we see less sweating. And it's really important to highlight that young children are also dependent on their guardians. So they are needing that assistance to provide that protection, be it shade, be it air, be it replenishing fluids and breast milk. And so they're really dependent on a guardian, which creates vulnerability as well. Among the elderly, we see physiologic changes as well. So we see changes in how fat is stored within the body, decreased sweating, and the decreased perception of thirst. And it's important also, I want to highlight that when we think about these vulnerabilities, there can be multiple layers of risk factors among each person. So within the elderly, we may see some coexisting conditions. When we look at chronic medical conditions, we think about how as the body tries to cool itself, it puts a lot of excess stress on our cardiac and kidney systems. And so people with underlying cardiovascular disease or kidney disorders may have additional stress on those organs trying to cope with the heat. We additionally see that dehydration can put additional stress on people with these pre-existing conditions that are cardiovascular or kidney related. And dehydration can also really impact glucose control among diabetics. We heard last week about how increased heat also impacts air quality. So we can see exacerbation of respiratory disease related to that air quality change. In individuals that have dementia or maybe using substances, we may not see the same awareness in cueing to hydrate, awareness in some of the heat warnings and preparedness for heat waves and events. And then finally, when we think about mental health conditions, heat can really impact the ability to sleep well and get a good rested sleep. And we also see that certain medications for chronic mental health conditions can impact thermoregulation. And as we think about medications, we have kind of a long list here, and some of those medications that I talked about are for cardiac conditions, are for mental health conditions. And so it's important to know that these medications can put your patients at risk. So we're going to talk about these specific medications a little bit later in the presentation as we talk about some of the actions, because as nurses that may be prescribing or that may be doing discharge planning, it's important to recognize that these medications may put your patients at risk. And so this slide deck will also be available to kind of reference this slide if you're thinking about particular medications you might be prescribing or providing discharge education with your patients. Okay, now shifting gears a little bit to talking about some of the sociocultural factors and adaptive capacity. So we can also have vulnerability due to some of the underlying built environment and social determinants of health that exist. So when we think about the built environment, thinking about housing materials, are buildings insulated? Are they built with materials that absorb more heat? Thinking about multiple stories of buildings, we know that heat rises. So if there's a building without air conditioning, the higher stories of that building are going to be hotter. And so those individuals might be more vulnerable just based on where they're living. Thinking about clean drinking water and access to being able to hydrate during a heat wave or during an extreme temperature day is also very important. And as you can see here in this graphic, this is showing you an urban heat island. So we think about urban heat islands in areas that are more densely populated, where there's a lot of dense housing, building material, asphalt, pavement. These materials all absorb more heat. So we tend to see in more urban areas that are more built up, the temperatures are warmer. And so a protective action and protective feature that can happen, and we should kind of think about advocacy for, is including more green spaces. Green spaces provide more shade and tend to be cooler environments. So again, that built environment can really impact the vulnerability of a specific community or individual based on where they're living. Social isolation and ambulatory, being non-ambulatory or using a mobility device, although those are individual factors about a person, I put them on this slide because it is really important to think about during a heat wave, some of the social supports and healthcare access that may be needed. And so if someone is living in social isolation, or maybe they're non-ambulatory and a heat wave is occurring, we need to kind of think about how are we going to safely transport these individuals if they need to get to a cooling center? How are we going to provide the access to get to a healthcare facility or supplies that might be needed? So these are things that kind of as a community, we need to kind of build into our heat plans. Language barriers, environmental and health literacy. So when we think about these barriers, it's really in access to being able to recognize the heat warnings and the health warnings to be able to act during a heat wave or during an extreme heat day. And then finally, being unaccustomed to heat. So we know that our heat is increasing in areas where it had not been before. We know that it is occurring in times of the year where it had not been happening before. And so our bodies physiologically do acclimate to the heat. So if we're talking about a population that maybe has not seen extreme heat days, and now all of a sudden we're having more heat days, their bodies may become more vulnerable just due to that unaccustomedness to that experience. And the last category is the exposure to the heat itself. So it's important to really think about heat index when we think about the experience of heat. So heat index takes into account both the ambient temperature and humidity. So that's really how the heat is going to impact us physiologically. Again, because we think about how our body sweats, our vessels dilate, all the things that we do to adapt to heat are influenced by both the temperature and humidity outside. Duration of exposure can also make someone more vulnerable to heat when we think about someone that's been outside for maybe 1 hour versus someone that's working an 8 to 12-hour shift outside during the hotter times of the day. So that can really impact vulnerability as well. Some populations that are going to be particularly at risk. So the unhoused may not have shelter from the heat exposures and may be just out and exposed to the heat more during the day. Outdoor workers, those making their livelihood, needing to be outside, doing their work, maintaining their employment, may be more exposed to heat. When we think about athletes as well as outdoor workers, we also see that extra component of being exertional. So that kind of metabolic heat that's being created on top of that ambient heat that exists. And then finally, our incarcerated individuals who are in confinement and may not have as much control over whether or not they're being exposed to heat. And as we talk about workers, this can be an entire webinar in itself. I just wanted to highlight kind of the global impact that we are seeing on workers. So if you look at this graphic to the side here, you can see that regions with the highest workforce exposure, we see our Africa at 92.9% of the workforce, the Arab states at 83.6% of the workforce, and Asia and the Pacific at 74.7% of the workforce. So that is a significant amount of the workforce that is being exposed to heat kind of on their regular basis. And looking at this through a global lens, we also do see that the Americas and Europe and Central Asia are regions where we see the most rapidly increased heat-related occupational injuries. So this is really impacting the world globally. And I put this other kind of table here to highlight that although we really focus on outdoor work exposed to that outdoor ambient temperature, some indoor jobs are also really at risk for heat exposure. So we think about appliances that generate heat. So working in places like bakery and kitchens, working in manufacturing where maybe the machinery generates heat on top of that already hot environment is going to put those individuals at risk. And we also think about in different warehouses and factories, some of the ventilation on hot days. So it does impact both indoor and outdoor workers. And we do see that, again, as someone is not acclimatized to heat, they're going to be at a higher risk. So maybe it's someone's first day on the job working outside. We want to pay particular attention to those individuals because they will be at a higher risk, not acclimatized. And I want to leave off my kind of portion of the talk with this slide here that Teddy Potter actually showed in the first series, which talks about how really our next generation is who is going to be more and more vulnerable to this hotter and different world. So with that, what our goal is today is to help as nurses talk about what we can do to prevent some of this illness, what actions we can take. And I'm going to pass off to my colleague, Dr. Duderstadt, to talk a little bit about how you can recognize heat-related illness among our patients. Thank you.
Thank you, Dr. DePhillips. So let's look first at what is heat-related illness. Heat-related illness is a spectrum of illness which results from an increase in body temperature due to exposure to ambient heat and also our own metabolic heat production with the inability to compensate. So I want to look specifically at heat, humidity, and how the human body does compensate. First, let's look at the body's heat load. So the body's heat load results from metabolic processes and absorption of heat from the environment, and environmental heat is determined by ambient and radiant temperatures, humidity levels, and airflow. So as you can see, there's a combination of how the extreme heat events impacts individuals. Next, heat in the body travels from the tissues to the blood cells on the skin surface, and then they are vasodilated to react to the temperature difference between the skin and the surrounding air. And we'll see in the next few slides that this makes a difference in terms of age, how the body is efficiently able to react to extreme heat events. So the body maintains optimal temperature. Thank you. The body maintains optimal temperature through different heat dissipation methods. First, we think about convection. This certainly could be from a breeze that might come in, or sitting under a fan, or someone fanning you if you have some severe or mild heat symptoms. It comes from conduction, which would be taking a cool shower, putting cold wipes on someone. Also from radiation, it can be through natural heat loss by the body, and evaporation, drying of sweat. So that's very familiar to us, those of us who work or live in extreme heat areas. And next, let's look at the risk. So in high ambient temperature settings above 35 degrees centigrade or 95 degrees Fahrenheit, evaporation is the main mechanism for cooling the body. Evaporation, however, becomes less effective as the temperature and humidity reach very uncomfortable levels. So many individuals globally and in the South and the US are living at temperatures well above what's comfortable. Some in the US have been up to 120 degrees Fahrenheit in the desert areas, and certainly way above 40 degrees centigrade for areas globally. So I want to look at specific symptoms of heat exhaustion and heat stroke. This is particularly important for nurses, for healthcare providers, and to teach families and individuals how to recognize these symptoms to help us mitigate heat stroke. So for heat exhaustion, certainly one of the initial signs would be faintness or dizziness, and this can occur from dehydration in very hot levels of climate. Excessive sweating, so that means through all the clothing and just significantly from all areas of the body. Cool, pale, clammy skin. This is a concerning initial sign of heat exhaustion, and this is where you want to begin to really work to mitigate those symptoms, if at all possible. Individuals can express nausea or also actually have vomiting. They may have a rapid, weak pulse. This indicates that they're beginning to do, the heat is beginning to have some stress on the circulatory system in the body, and also severe muscle cramps, particularly they start in the legs for those who have been exercising. And I hope that individuals are recognized at this point so we can limit those who experience heat stroke and limit any burden on hospitalizations. So for heat stroke, the symptoms would be a throbbing headache, like the severe headache pain the most the individual has ever had. They're not sweating, which is a very concerning sign in extreme heat events. Their body temperature could be above 103 degrees Fahrenheit or 39.4 or 39.5 degrees centigrade. Again, they would actually obviously have vomiting generally in a heat stroke. They would have a rapid, strong pulse, which means that the cardiovascular mechanisms are really being extremely stressed in the body, and they may lose consciousness as the next sign. So we really hope that nurses and healthcare providers can help families to know these symptoms, to mitigate them, to limit having to take them into urgent care. Let's look at the different specific symptoms of the difference of heat stress and the impact on adults and then infants and children. So I think Dr. DePhillips did mention some of these symptoms, but I want to discuss the range of symptoms so you realize that it can be different in different individuals. So for the milder symptoms in the adult population, and again, we want to recognize these symptoms early to mitigate the effects during extreme heat events. So for mild symptoms, these can generally be treated at home or in the community. An individual may have dry lips and sticky mouth, a sign of beginning dehydration, excessive thirst. So even if they drink 4 to 8 ounces of water or 4 to 16 fluid ounces, then that can be problematic in terms of not really quenching their thirst. They have excessive sweating, again, where they'd sweat through all their clothing, anything that they have on, and the other areas of the body as well. They actually have nausea and some vomiting. They can develop heat rashes even in adults, and these can be even blister-like rashes in very severe heat events. They may have a mild, slight high body temperature. This changes with the severe symptoms. Definitely have cramps, usually first in the legs and then can be in the arms. And some individuals may have nosebleeds, which can be common, and particularly in hot, dry environments. So we want to mitigate these symptoms before we move to severe symptoms. For severe symptoms, and this one they should be taken for treatment immediately or called for treatment. They first have confusion. They're not responding clearly. They may have some signs of seizure. For those individuals, certainly that have a seizure disorder, they would have a seizure. They would drop into a coma, very dull, not waking up. And this is a very severe sign and the most severe signs of heat stroke. They would have a very high body temperature, 140 degrees Fahrenheit, 140 degrees Fahrenheit and 140 degrees Fahrenheit. They may have fainting, dark urine, and this is a late sign. First, it would be no production of urine in more than 8 hours, and the dark urine is a very, very ominous sign for severe symptoms in heat stroke. They might have a rapid heartbeat and rapid breathing, so that the system is trying to compensate to really make the cardiopulmonary system work. And they're definitely not having sweating, so their skin can actually be wet and hot. So again, severe symptoms if untreated can lead to heat stroke. So next, it's important to look at the impact on children. And you can see even visually in this chart that there's many fewer slides in infants and young children than there are in adults. So it's harder to recognize, particularly in infants and children under 3 to 4 years of age. So the milder symptoms for infants, initially those under a year, would be heat rashes in the diaper area, heat rashes on the chest. This can also be true for preschool children, 2 to 4 years of age. They're extremely irritable, particularly infants. They cannot be calmed, even with trying to feed them or hydrate them. For severe symptoms, and again, these are much more subtle. You see, there's not as many symptoms as there is in adults. They're crying without tears. They may have a sunken eyes or a sunken fontanelle, in their forehead area. They actually could have vomiting and diarrhea. So the system is really trying to dissipate heat and compensate for the extreme heat. They can be extremely irritable where they cannot be calmed in any way. And they would have very few wet diapers, the same as the decreased urinary output in adults, but this occurs over a much shorter period of time. So these are the milder symptoms, and these are the severe symptoms in children and infants. So again, really recognize how subtle these differences are between the symptoms in adults. So for children 4 years and older up to young adulthood, they can have express nausea, express having headache. They can also have muscle cramps, and you'll recognize this most in older children and adolescents or any children who are exercising vigorously outside in extreme heat events, because this is the common age group where it's not recognized in terms of extreme heat. The severe symptoms in this age group would be deep or severe muscle pain, especially after exercising outside, which is common in adolescents. So again, these are much more subtle symptoms. You may have an adolescent who complains of severe cramping and bends over, but then he actually becomes delirious. And so we want to really prevent these symptoms early by hydration, removing children if at all possible, limiting competitive sports in severe heat events or extreme heat events. And again, adolescents are particularly vulnerable with increased exercise. For those who are playing sports that have a lot of clothing on, that's also an increased risk. And I did want to again just emphasize the difference metabolically between children and adults. So children produce more heat per kilogram than adults, and this makes them more vulnerable to extreme heat events. Young children have a higher surface area to body mass, and they can absorb more heat than adults. So they become extremely symptomatic much earlier than adults in an extreme heat event. If they're in a hot area, a hot vehicle, or in the sun without any mitigating effects, that can be really a challenge for infants, and the absorption occurs very quickly and symptoms occur very early. So children may have a lower rate of sweat production than adults, and as Dr. DePhillips mentioned, they have underdeveloped sweat glands, particularly in children under 2 years of age. They won't have the excessive sweat that older children have. So it's very important to make sure they're hydrated, lightly dressed, and protected from severe sun. And they are more vulnerable again to extreme heat events. So these are the population that I'm particularly concerned about in extreme heat events, and making sure that the heat is mitigated for them in whatever way possible. Next, I wanted to talk about heat-related pregnancy. And it's important to think about the significance of pregnancy and how that impacts the impact of heat. So heat rashes can occur the same as in adults in body areas that rub against each other. They might have muscle cramping in the stomach. And more severe symptoms, again, is a very high body temperature, as we mentioned, above 39 or 103, 39 degrees centigrade, 103 Fahrenheit. They could have extreme nausea, possibly vomiting, early contractions, which is a concern because it means that's the later sign where the body is also really impacted by the heat and dehydration, and that can impact the pregnancy. Swelling of body parts, this is a very late sign, as well as severe muscle cramping. So we need to be particularly careful with pregnant individuals in our areas during extreme heat events, and make sure that they're aware of these symptoms and mitigate late symptoms in terms of the impacts it could have on their pregnancy. For heat stroke and death, this is one that we've talked about in terms of heat stroke. Of course, we want to mitigate any of those early symptoms, but I think it's important for us as nurses and healthcare providers to think about how this impacts the other systems beyond the humans that we've been talking about, all individual and elderly populations. And Dr. DePhillips touched on this slightly in her presentation, but definitely there's a potential disruption for infrastructure, including power outages, which have occurred in many areas of the US and other areas globally. It can compromise water treatment centers if the infrastructure goes down, and can also reduce worker productivity. This is in severe and extreme persistent heat events. It can have an impact on our healthcare systems, and we've seen this during some of our other events, COVID and others in the world, that the healthcare system can get overloaded, the hospital can be overcrowded. So we want to prevent these symptoms in the community early in order to mitigate any heat stroke or severe heat exhaustion that occurs that would have people moving into the emergency rooms, emergency departments, and also cause overcrowding. Increased ambulance calls. If you were calling for emergent vehicles, they wouldn't be available, and increased response time. So the other piece that we need to look at in terms of the long, extended extreme heat events, it can increase transmission of waterborne and foodborne diseases, particularly if there's limited refrigeration, not available sources of the water is not being flowing, and becomes contaminated. That can be very problematic as a later sign in extreme heat events. And then, of course, just initially, the impact on humans, there can be a risk of accidents, trauma. Certainly, we've seen mental health deterioration in many areas around the globe with these severe extreme heat events. And this is a real concerning symptom that we need to recognize early, both in adults and children. And then for heat illness and exacerbation of heat-sensitive diseases, we talked about that and reviewed certainly cardiopulmonary, diabetes, other thyroid conditions, mental health conditions. The medications can be impacted by those individuals that are being treated for those conditions. So very important to continue to try to mitigate any of these late effects, if at all possible, by nurses and healthcare providers. Next, I'd like to have Dr. Gina Friel continue.
Thank you, Drs. Duderstadt and DePhillips. It's so nice to be here. We have heard throughout this course that the impact of heat can amplify air pollution, drought, hurricanes, mental health, vector-borne diseases, and wildfires. Heat is a risk multiplier. This means that extreme heat can exacerbate existing vulnerabilities and significantly increase the likelihood of negative consequences, amplifying risks not only concerning health, but also in areas, as Dr. Duderstadt mentioned, such as infrastructure, which can be disruptive to daily life, impacting productivity and access to essential services, especially in communities already facing challenges. Listed here are a few examples of how heat is increasingly reported in the news, online, and in the literature from sources that span the entire world. The Lancet Countdown, which was released earlier this month, is an annual international collaboration that tracks the health impacts of climate change and assesses the progress of governments toward the Paris Agreement. The data in this report, and in this chart specifically, show that many of the health-related threats and impacts of climate change are exceeding all previous records, not only for heat, but wildfires, vector-borne diseases, drought, and food insecurity. The purple arrow shown at the top center of this screen highlights the variables which pertain to heat exposure. The red arrow seen toward the middle of your screen highlights the x-axis, which indicates time in years from 1991 until 2023, moving from left to right, representing a range of values from more favorable, seen in purple, to less favorable, seen in red. For example, over the time span from 1991 until 2023, infants experienced a greater average number of days exposed to heat waves. Adults over 65 were exposed to an unprecedented 50 more days of health-threatening heat, which resulted in a 167% greater annual death rate. The hours of sleep lost due to heat exposure increased. Heat exposure also led to record losses in the number of hours available for safe outdoor physical activity and labor, leading to potential income loss from labor reductions equating to billions of dollars in US. The ecological planetary health model, which we have seen throughout this course, provides an effective platform to discuss the preventative actions and multiple levels of influence that nurses have on behaviors and actions to address the health of our planet. The circles here represent how nurses can take actions individually, within their families, communities, nationally, internationally, and on a planetary level, utilizing climate mitigation, adaptation, and resilience strategies that influence human health. I will take a moment to review some of the key climate terms and how these terms relate to us as nurses. These will also be described in more detail next week with our upcoming session with Dr. Bade. First, adaptation, which refers to our response to conditions that are already occurring in order to minimize impacts. Increasing knowledge of how a changing climate affects health so that we are better able to routinely incorporate information into daily practices and educate patients, families, colleagues, legislators, students about preventative measures is an example of adaptation. Next, mitigation, which refers to actions that actively reduce or remove greenhouse gas emissions from the atmosphere. Things like utilizing active transportation, such as biking or walking instead of driving, whenever possible. Eat less meat and increase more local fruits and vegetables, and create less waste, as Dr. McDermott-Levy discussed in her recent session on pollution. Next, resilience, which is anticipating and preparing for climate events. In the previous session on extreme weather with Dr. Sattler, we learned about disaster preparedness planning. Similar to that, we will today learn about heat action plans, which nurses can prepare and implement to play a key role in efforts to build resilience in the communities that we serve. Advocacy: utilize your trusted nursing voice in your communities and nations, joining ANNI, as well as other international nursing organizations such as Healthcare Without Harm and the Global Climate and Health Alliance. Nurses can receive timely information, resources, and opportunities to become more involved. In 2022, the World Meteorological Organization and 6 international data sets report all 7 of the warmest years have been since 2015. This is a trend that is expected to continue. These findings have implications for nurses and all healthcare stakeholders. Knowing where to receive accurate information regarding how heat is monitored and communicated in your area is one important thing that nurses can do. The National Weather Service in the United States utilizes consistent alert criteria for heat across the nation. In the next few slides, I will discuss some methods utilized in the United States and some measures available in other regions of the world. We have a global audience joining us here today. I would like to take this opportunity to invite anyone to share in the chat any trusted resources that might be available for monitoring heat in your specific location or region. We would love to learn from you. In many regions of the world, the most effective way to receive information regarding heat is from local meteorological authorities. For example, in Europe, it is the European Center for Medium-Range Weather Forecasts, pictured here on the left. In the Philippines, the local resource is known as PUGASA, pictured here on the right. Heat alerts are often made through apps. One such app is CapCap, pictured here on the left. A person who has this app on their phone will receive alerts regarding heat waves and hurricanes in locations such as Antigua and Barbuda, Trinidad and Tobago, and St. Martin. In Australia, the Australian warning system, pictured here on the right, provides a national warning system during heat waves in order to communicate the severity of heat events and recommended actions. In the United States, the Weather Ready Nation website is available to anyone by entering a zip code, seen here in the green section on the left, or simply by clicking on a particular region on the interactive website for locations such as the US, Puerto Rico, and the US Virgin Islands. Doing this will provide a wide range of color-coded weather alerts, not only for heat, but also flooding, fires, winter storms, tornadoes, and more. Some people may even be affected by more than one alert. A great resource for nurses is the Real-Time Climate Heat Risk Alert Program, which is a collaboration between the Harvard T.H. Chan School of Public Health and Climate Central. Nurses, nurse practitioners, and administrators at healthcare facilities that sign up for alerts through the website here will receive notifications about dangerous heat, guidelines for how to better care for vulnerable patients experiencing the effects of heat. This is an example of what the email alert might look like. Alerts include dates of expected heat, information for who is at risk, resources for patients, specific actions for clinical and administrative staff, and explanations about the type and severity of risk. The real-time climate alerts also include links to the AmeriCares Heat Toolkit. This toolkit is an evidence-based resource that can be downloaded for free and adapted for use by anyone globally. The 2024 updated version released this fall includes guidelines for healthcare providers, patients, and administrators on heat, wildfires, hurricanes, floods, and general guidance. The documents incorporate disease-specific information that can be sent directly to patients in both English and Spanish. Shown here is an example of a heat action plan for patients. Identifying cooling centers and preparing a heat action plan, just like a nurse might prepare a disaster plan or an asthma action plan for a patient, is another example of that climate strategy resilience that I mentioned earlier. So now a quick recap. What we know about heat and heat-related illness. We know who can be affected by the heat. We know to expect the heat. We know what signs and symptoms to look for. We know when and where the heat will impact us. And next, we're going to discuss how we as nurses can take action to minimize the signs and symptoms of heat-related illness and reduce vulnerability. Staying hydrated is one of the first preventative measures. Drink water. If you are drinking a lot of water, make sure to add a little extra salt to your food or add some electrolytes to your water to reduce the chance of experiencing problems by abnormally low electrolyte levels. Choose local foods that are in season and contain a high water content, such as watermelon, cucumbers, and tomatoes. Second, reduce consumption of sugary or highly caffeinated drinks, and avoid alcohol, which reduces alertness and can impair decision-making, perception of heat, and exacerbate dehydration. How do you know if you're drinking enough? Simply look at the color of your urine. Studies tell us urine color is not only a sensitive marker of assessing hydration, it is also very practical. Generally, in the morning, the color of urine is a darker shade of yellow. This is normal. As the day progresses, a person who is drinking enough will have urine that looks more like water or the color of lemonade. If urine is darker than that on this spectrum pictured here, or if a person is not voiding every hour while they are awake, they are likely not drinking enough fluids. Drink water before the sensation of thirst occurs, because once thirst is perceived, a person is already mildly dehydrated. I'm going to expand a bit on this chart that was seen earlier in this presentation by Dr. DePhillips. And without going into specific details on each medication, I would like to highlight a few that are prescribed for common conditions which have the potential to increase the risk of heat-related illness. First, antihistamines such as diphenhydramine or Benadryl, serotonin reuptake inhibitors or SSRIs such as sertraline or fluoxetine, which are commonly taken for anxiety and depression, thyroid medications such as levothyroxine or Synthroid, laxatives, and stimulant medications for attention deficit disorder or ADHD, such as methylphenidate or Ritalin. The most important thing about this slide is being aware of this so that we can educate patients and families that these medications can, in one way or another, affect the ability to sweat and or the ability to perceive heat. We know temperature is an important variable in drug stability, but we are not entirely sure as to what extent medications are affected by prolonged exposure to heat and the impact it has on the clinical effectiveness of the medications. Some tips to protect medications from heat include keep medications out of the direct sunlight and hot cars. Instead, store them in a cool, dry, dark place, ideally between 59 and 86 degrees Fahrenheit or 15 to 30 degrees Celsius. Some people may use mail order pharmacies. If so, try not to let those medications sit out in that hot mailbox and bring them inside as promptly as possible. Be extra careful with life-saving medications such as nitroglycerin, epinephrine, and naloxone. If these become damaged by the heat, they may not be effective in an emergency. If you do need to transport medications that are usually stored in the refrigerator, or if there is a power outage, keep medications as cool as possible in an insulated cooler, but do not place the medications directly on the ice. Next, we'll talk about sunscreen. If you do have to be out in the sun, there are a few practices and principles to keep in mind. The first principle is sunscreens provide UVA and UVB protection. Both rays are associated with cancer, but they affect the skin differently. UVA rays are most related to skin aging. Remember, UVA, aging. And UVB rays are most associated with skin burns. Remember, UVB burns. Another element of sunscreen is the sun protection factor, or SPF. An SPF of 30 blocks 97% of the UVB rays, meaning 1 out of every 30 rays reach the skin. You'll also want a product that is water resistant, which means the sunscreen is effective for 40 to 80 minutes of contact with water or sweat. Apply sunscreen every 30 minutes and reapply every 2 hours to all sun-exposed areas. And don't forget the sunscreen for the lips. Sunscreen should be avoided in infants less than 6 months of age due to their inability to metabolize the sunscreen ingredients. Instead, use lightweight, light-colored, cotton, sun-protective clothing, wide-brimmed hats, and sunglasses to protect the eyes from damage from cataracts. For children 6 months and older, minimize sun exposure between 10 a.m. and 4 p.m. Gel sunscreens are generally a better choice for oily skin, and cream sunscreens are a better choice for drier skin. Finally, sprays. While they are better than nothing, they are typically the least effective option because a significant portion is likely carried away by the wind. If sprays are used, they should be rubbed into the skin immediately after applying. Sunscreens that are generally recognized as safe and effective contain ingredients such as zinc oxide and titanium dioxide, which are also reef safe, meaning that they do not contain chemicals harmful to coral reefs and other marine life. They are also usually free of parabens and synthetic fragrances, which tend to be the inactive ingredients and the allergens in sunscreen. If you do have to be out in the sun for sports or with work, pay attention to the heat index, which refers to the feels like temperature, taking into account both temperature and humidity. What is important about this slide is that as the heat index increases, so does the risk of heat exhaustion and heat stroke, especially with prolonged exposure. Be sure to check the heat index prior to activity participation. And be that nursing voice at the table to implement policies that include postponing or canceling practices on games of high heat index days. Ensure coaches and referees are trained in CPR and recognize the signs and symptoms of heat-related illness. Children often depend on the direction of coaches and camp counselors to take breaks from exercise and hydrate. Breaks should be frequent and in the shade, with lots of water or electrolyte solutions before, during, and after exercise. Athletes are often required to wear safety protective gear, which is important, but take into consideration that some gear, such as helmets and shoulder pads, can affect cooling. Recognize artificial surfaces such as blacktop or turf fields can, depending upon the material that they are made with, can in some cases be 20 or 30 or 40 degrees hotter than the actual temperature. The scientific evidence compels the nursing profession to educate nurses across all levels of academic and professional education to ensure competency in addressing mitigation, adaptation, and resilience strategies. This is our call to action. Nurses must be competent practitioners and advocates and change agents to ensure the public's health in the face of climate threats. In conclusion, anyone can be vulnerable to heat. There are many ways that nurses can use climate strategies to reduce vulnerability and minimize the effects of heat exposure to prevent the spectrum of heat-related illness. I would like to conclude with a drawing followed by a quote. This drawing was done last year by a second grade student from Australia. It depicts a sad planet Earth holding on fire, holding a sign that says help. In the words of Anne Frank, how wonderful it is that nobody need wait a single moment before starting to improve the world. As nurses, we can make a difference in our health, the health of our patients that entrust us with their care, and the health of this planet that we all share. Thank you so much.
Thank you so much, Dr. DePhillips, Dr. Duderstadt, and Dr. Friel. That was such a wonderful presentation and such a wonderful way to end that with the quote from Anne Frank. And your talk has just reminded me how extensive and comprehensive this course is. There's always so much more that we can learn, and it's, yeah, we've had some wonderful questions in the Q&A, which I'd love to put to you now. And we'll go to those questions and hopefully we get a chance to answer a few of them. We had a few people curious about acclimatization, the controversy surrounding acclimatization, acclimatation, I should say, the evidence behind it and the thermoregulatory capacities of humans. I might just go to the panel, open that one up if anyone had any thoughts on that question.
I think what we kind of see with extreme heat, so we've highlighted a lot of populations that are particularly vulnerable, but with extreme heat, when we start hitting such high temperatures, physiologically, we're all vulnerable, right? None of our bodies can really fully compensate. And so, you know, OSHA, so the Occupational Safety and Health Administration here in the US did put forth some information about workers specifically, and how 50 to 70% of workers had outdoor fatalities in the heat in the first couple of days of working. So that's really what I was kind of referencing in terms of vulnerability for that population, how they're providing additional exertion in a new job, as well as being outside exposed to the extreme heat. And so someone who may have been doing that job for a few days, according to that OSHA data, may not be as high of a risk for that vulnerability. But again, with extreme temperatures, we're really all physiologically at risk. And I think also not having exposure to extreme heat previously in certain areas, they may not have some of the structural resources in place that also put those populations in a more vulnerable place.
Wonderful. Fantastic. Thank you. And how can nurses collaborate with pharmacists and other health disciplines to ensure that medications are not damaged by extreme heat?
I think just informing our patients when they receive certain medications, proper storage of our medications in places that are in a cool, dry, dark place. I think we as nurses can just remind patients that when they are on medications that, you know, simple things like protecting them from the heat by not leaving them in our cars and not leaving them in places that are very hot conditions, because that can impact the effectiveness of the medications.
And just one other additional point, I just have a moment, but there was an important point in the chat about that we didn't mention nurses and healthcare providers. So just a quick point about that is it's very important for us as nurses and healthcare providers to care for ourselves first If we have symptoms of heat exhaustion, we need to recognize it, hydrate, take a break, because in order to serve others, we need to really first take care of ourselves. So thanks for that comment in the chat.
Yes, I also noticed that comment, and I think it was such a wonderful point. Thank you again to our speakers. I wish we had more time to look at the rest of the questions, but we are at time, which means we will need to close. Thank you all for joining us from around the world. Immense gratitude to you for sharing your, to the speakers for sharing your tremendous insights. And please join us again next week for session 9 in this series, Nursing on the Front Line of the Climate Crisis, Education for Action. And the topic for this session, as Gina mentioned, will be on climate change mitigation, adaptation and resilience, and will be presented by the wonderful Dr. Heather Bade. We are here for Education for Action. This is what joins us together. Take care, everyone. Thank you for coming, and do enjoy the rest of your day, morning or night. Thank you.